I think it's because the physicians have the informal power. They already are in the right positions. So they have the right position, they have the access, and when staff seeing physicians lead these issues, they want to follow them. Most staff have very close working relationships with physicians, so when they get together and they're headed in one direction, we want to follow. Sounds like something from Taylorism, which is how can we get the workers to care about something for our own self-interest, rather than servant leadership, which is the total opposite of that, which would be how can we give them the power that we took away from them back so that they can use that to create an organization that we can be proud of. That's the message that everyone at every level has to hear. So what's currently happening is that healthcare is a business, and in Maslow's hierarchy of needs, this business called healthcare in the United States today, whether you can say it's set up, you can agree or not, whether you like the way it's set up, but the bottom line is that we need money. It has to generate enough income to keep the doors open, and staff at every level feel that. So when you send out a initiative, or when you send out a message that says, look, the most important thing is quality or safety and you've got to care about the patient, and then you ask for a resource and they say, no, you can't have that, they're going, well, then staff think, well, you weren't serious in the first place. And what we know from the research is that when there's an ambiguity between what you say and what reality is, then staff will only listen to 7% of the words, and only 7% of the message. So it's a complete disengagement. There's nothing more powerful than culture in a hospital. Relationships have been perceived as soft stuff. That's why when you ask the staff nurses, et cetera, when you ask a group of nurses, who's at the bottom, they'll say rehab, who's at the top, it's the ICU, because the ICU has more technology. So what we don't understand as hospital leaders is that, our everyday actions reflect our greater society norms, where we think that the person who has 6 or 7 machines or pumps and the most technology is worth more or has more value than the person who has the time. But of course, if you ask the patient, they would tell you that both of those are of equal value to them. So I think that historically, what we've seen in the 1990s is that they cut education and they cut staffing across the board, and then of course there were sentinel events, paid out millions of dollars, did root cause analysis, found out 5-10 years later that the cause was education definite, put the education in again. Now we're just in for another cycle. So the problem is that the relationships have not been looked at because they're perceived as soft stuff, when in fact they're the very core. They're the thread, they're the team that you need in this day and age to move your hospital forward. Because people will do for you more than you ever ask them. If they feel that they belong, if they feel that they have a purpose, if they're allowed to have some autonomy and power.